Well, imagine being in pain, but current treatments don't help, or suffering from clinical depression and current medications and therapy also don't help.
Some people are turning to a Covington doctor for a medication that is considered controversial by some, but safe and effective by others. Medical reporter Meg Ferris takes a look at both sides in tonight's special report.
At only 25, Laura Coatney's life dramatically changed several years ago when she tripped while in college at Cornell. Her complex regional pain syndrome means pain just being touched.
I'm in constant pain on a scale from 1 to 10. My normal day is a 6 or a 7, which is a lot better than what it used to be.
Stand up straight, girl.
In her early 70s, Desiree Krenning had excruciating back pain. She became a shut-in, unable to hold and enjoy her great-grandchildren, grandchildren, and children.
Emotionally, I was getting depressed, and my husband saw it more and more, and I just sat in a chair and went from the bed to the chair, and it was horrible.
And this middle-aged man with a good job has been suffering from a different kind of chronic pain, severe clinical depression.
They gave me a test, so my scores were like extremely depressed. I was, like maybe possibly in danger.
All of them had a variety of expert, evidence-based medical treatments, but they say their lives changed and conditions dramatically improved when they discovered something different, something the Louisiana State Board of Medical Examiners says is not FDA approved, has a potential for harm, and warns doctors is ill-advised in a clinical setting.
For me personally, this has been the only thing that's been truly helpful with keeping my pain at bay.
I mean, I love him. I call him my miracle worker. He's giving me back my life.
Did you really feel differently about life?
Oh yeah, oh yes, absolutely.
These patients are among the first in Louisiana to use infusions of ketamine for chronic pain or chronic depression. Ketamine's been around for 5 decades as anesthesia. The World Health Organization considers it one of the most effective and safe medicines. Licensed veterinarians say it's essential to their practices. Because it puts people in a trance while providing pain relief, sedation, and memory loss, it's also been used as a date rape drug and taken illicitly in clubs known as Special K, even killing abusers who wanted a short-term, out-of-body experience.
You don't get an infusion here unless you're referred from a physician. So you can't walk in the door here and go, hey, I want ketamine. Doesn't happen.
Dr. Brian Ball is a board-certified anesthesiologist and director of anesthesiology at Lakeview Regional Medical Center in Covington. He's been using ketamine in the OR for 30 years. A year ago, he opened the first and only ketamine infusion center in Louisiana.
Surprisingly, a large number of my patients are physicians or physicians' family because they see it, they see the benefit.
Dr. Ball says he opened only after the Louisiana State Board of Medical Examiners gave him the okay, but with many restrictions. He's treated more than 350 patients and prefers to work with patients' regular pain doctors or psychiatrists. Patients range from 17 into their senior years.
I get the worst of the worst. I don't get patients that just start having a little ache or pain. I get them when everyone else has failed.
I totally understand the drive behind this. The reality is that our treatments for depression are getting better and better, but there are still too many people who have their lives ruined with this illness or even kill themselves because of depression.
Dr. James Barbie is a board-certified psychiatrist credited by many patients for their success. He typically gets patients after a dozen medications have failed to help their mental illness. He's had 6 patients get ketamine infusions. Some are out of state. 2 have shown short-term improvement. He's not using ketamine now because for this treatment-resistant population, he's not seen studies that it can help them. What he's seen in treating depression is compelling, but he wants to wait for more science to assure that it works, is safe, without long-term side effects of the brain, as was seen in animal studies at high doses.
Even though we are using much lower doses in humans, it appears that the effect of ketamine in depression is relatively transient and lasts maybe a couple of weeks to 4 weeks on average. In some people, it's only a matter of days.
Almost invariably, the toughest ones are the patients with treatment-resistant depression.
Dr. Ball says there are patients who need 6 infusions over 2 weeks, then regular booster infusions later. But for some fibromyalgia patients, they're one and done. There are migraine, diabetic neuropathy, and phantom limb pain patients. Pharmaceutical companies are doing studies now, and the FDA has it on the fast track for major depression disorder. But still, he can tell early on those who will not be helped.
It breaks my heart to tell a patient that, because usually I get the patients that are at the end of their rope.
But these are believers.
I can get up and down. I have not had pain in my back since my last shot. Nothing.
It doesn't get rid of it, but it makes it so much more manageable.
Just when you get up in the morning, it's just a new day.
Meg Ferris, Eyewitness News.
Now, the cost is $350 an hour for an infusion of ketamine, which is what most patients need, and insurance does not pay for the treatment.